Hi, I'm Laurie Hutcheson, Executive Director of the Lobular Breast Cancer Alliance, and I'm happy to welcome everyone to this interview with our new Scientific Advisory Board member, Dr. Anita Mamtani. I'm going to tell you a little bit about Dr. Mamtani and then ask her a bunch of questions about her interest in lobular breast cancer. Dr. Anita Mamtani is a breast surgical oncologist at the Memorial Sloan Kettering Cancer Center and an assistant professor of surgery at Weill Cornell Medical College. She is also co-director of the ILC program at MSKCC, which launched last October in recognition of October 15th, Lobular Breast Cancer Awareness Day. Dr. Mamtani, I am so excited that you've joined the LBCA Scientific Advisory Board. So I'm going to go ahead and ask you a bit about your background and how you became interested in lobular breast cancer and what led you to agree to join our Scientific Advisory Board. So to start, can you just tell us a little bit about your educational background?
Course, thank you, Laurie. I am so delighted to be joining the Scientific Advisory Board, and it's a real privilege and pleasure to be able to contribute in this fashion. A little bit about me. My background, I was actually born and raised in Canada, but I have done all of my education from college onwards here in the United States. I was in medical school at Jefferson in Philadelphia, followed by my residency training in general surgery in the Boston area at the Beth Israel Deaconess Medical Center. After that, I came to Memorial Sloan Kettering for my breast surgery specialization, and I have been on faculty here at Memorial Sloan Kettering ever since. So that is kind of the journey that I've taken. As far as my interest in lobular, perhaps I can speak on that next. This is something that I think came very organically. Of course, I committed to being a breast cancer surgeon pretty early on. I was in my general surgery training, and I still recall being a junior resident, shadowing through the clinics and in the operating room, learning about different sort of subspecialties. And time again, breast cancer was it for me. I knew that I wanted to be in that arena, helping patients with that specific disease type. And I really liked in particular that the research that we could do, the advancements, the developments that we could make could be applied so directly to patients and it could impact their outcomes. We could, go on to cure such a large proportion of women who are faced with breast cancer. So that I found incredibly fulfilling. Then fast forward to my actual career as an attending surgeon, lobular had my heart pretty early on. I very early in my career had started to do some very basic retrospective research, just looking at very simple outcomes for lobular cancer patients. Some of the earliest small studies I did looked at margin positivity for lobular patients who have lumpectomy and another study looking at lymph node involvement in patients who had lobular disease. So very basic things. But in doing that work, I was so struck by how underrepresented lobular patients were in all the research that I was referencing. And to me, that became a theme that I observed. And I said, you know what, if I can, I'd love to try to fill this void in my own little way. So that was the beginning. And from there, I went on to not only continue to do various research works on lobular, but it has blossomed now into being a director for our lobular breast cancer program at Memorial Sloan Kettering, which we're very excited and proud of. And we hope that you will continue to hear of some of the progress we're making for lobular patients.
That's great. And you raised my curiosity. Now that there are a couple of medical institutions that have lobular specific programs, and thankfully yours is one of them. Um, I'm wondering whether you're creating a registry so that you can actually look back at the patients of Memorial Sloan Kettering with lobular breast cancer and start to look at, who is having a recurrence and, what are the circumstances, what were their treatments, and really be able to build a database that you can query.
Yeah, absolutely. I think good infrastructure, good databases are at the crux of good research. I have been blessed to have had mentors along the way, including our service chief, Dr. Monica Morrow, who is a well-known name in the breast cancer community. He became the service chief a number of years ago, and one of the first things she did was to set up very nice research infrastructure, very nice databases that we have been using to prospectively collect data on patients of various types through the years. So this has almost been ingrained in us, with the way things are done on our service, that we want to be able to answer questions using that data. Now, with this lobular program, we're applying that concept to the lobular patients. So certainly we do have data sets intact for patients who are early stage lobular. We have registry intact for metastatic lobular. So we're kind of identifying these groups of lobular patients, coalescing them, and then certainly, like you said, the goal would be not just to study the disease that they have and learn more about it, but yes, look at the outcomes, look how that varies depending on how they're treated. Those will be the exciting questions that I think will make a difference. So absolutely, that is a big part of it.
That's great. Well, I have a couple of questions for you both as a researcher and as a clinician. In terms of treating someone, if you know they've been diagnosed with lobular breast cancer, and we know that there aren't specific treatments or protocols for treating lobular breast cancer patients, but are there things that you think you do differently now when someone comes to you and perhaps they are even talking about having a lumpectomy, or that's what's been discussed? And, in my own case, I wasn't told that lobular breast cancer has a higher rate of needing more than one excision to have clear margins. And it was quite a surprise to me. But I'm wondering, do you address that differently with patients?
Yeah, I'm so sorry that that was, a tough journey for you, I'm sure. And I think in some way we owe it to patients who've gone through that kind of thing to have built the body of knowledge now. So, your experiences and other such patients now finally have brought this awareness, I think, that lobular disease is different. The way it grows is different. There are diagnostic challenges and there are therapeutic challenges. So I think half the battle actually was just recognizing that and making it known to the larger scientific community. So indeed, when we see a patient now and we see that they've got a lobular disease, I do personally, and I know many of my colleagues now as well, will make that a point of discussion and say that, hey, with this type of histology, we are not going to make assumptions that perhaps we would with a ductal type of breast cancer. We need to be a little bit more careful. We need to be a little bit more critical with the workup that we do. So I would say that for my patients, they are well informed. I try to be, making sure they're well informed about these challenges, that the diagnostics may not be as clear cut. You may have difficulty assessing the extent of a lobular cancer as compared to with the ease with which you would assess a ductal. Similarly, if we're going in to do a lumpectomy, as I said earlier, we have that risk of slightly more likelihood of positive margins. So we inform patients of that. But in planning procedures and in planning treatments for those patients, I think we are a little bit more comprehensive, a little bit more tailored in how we image them prior to surgery, how we plan that lumpectomy, how judicious we are with the use of various imaging or surgical techniques for those patients. And I think it is credited to people like yourself who gave us that awareness from their experience that there are certain issues that lobular poses. And you mentioned one challenge, but this is just one example. Lobular has other diagnostic and therapeutic challenges. So in doing the research and exploring other avenues, I hope that we will come to a time where having a lobular diagnosis won't be quite so tricky or ominous. It'll just be, okay, we know how to tackle this and we're going to do X, Y, Z differently, apply it, and that's it. That's the goal.
Oh, great. That's our vision as well. Um, So, also related to that, I think I've shared that we conducted a survey with a lot of our constituents 2 years ago on the challenges of lobular breast cancer diagnosis and surgical decision making. And, one of the things we had heard was that there was potentially an over use or over selection of more invasive surgical decisions that because of the fear of recurrence or that lobular wasn't seen in one breast and it might still be there. And so We, in our survey, in fact, did find that there was concern, risk of recurrence, not wanting to deal with more imaging when it might be missed, and rather having a mastectomy or a bilateral mastectomy. I'm just wondering what you feel is most needed in research related to surgical decision making in lobular right now.
You're getting right to my heart here on the questions that we're looking at and asking. So thank you for
Sure.
bringing that up. Um, I think that, like you said, decision making on the end of patients with lobular disease has often been, as you said, fueled by those fears. Fear that are they missing something? Is it bigger than we think? Could there be occult disease in my other breast or somewhere else in the same breast? And these are very understandable concerns. Everything I just mentioned, that there are diagnostic challenges, therapeutic challenges. We know that based on the growth pattern of lobular, it's a tricky type of disease. And certainly it's very understandable that those concerns would exist in the mind of any woman going through this type of diagnosis. However, there is a good body of research, retrospective, which shows that when you compare outcomes stage by stage, patients who have, say, stage one lobular, compare them to stage one ductal. And if you look at those who do receive appropriate, therapeutic recommendations and carry through, they have their surgery, they have radiation if required, they have the appropriate systemic therapy, the outcomes are excellent. So in my mind, I guess I would say to patients that having lobular itself should not be something that sends you off the edge. It should not be something that necessarily pushes you to making an extreme surgical decision, which, for instance, double mastectomy is a big surgery and it may be very right for some patients, and that's great, but it may not be right for other patients. And you would never want patients to make a decision purely out of fear or purely out of misunderstandings. But this is where I think the need is for research. It is to identify those who are more likely to have advanced disease, who are more likely to be high risk for recurrence, so that we can provide those numbers to those patients and then they can make an informed decision and use numbers rather than any kind of fears or emotions to drive their decisions. And at the end of the day, it's so lovely to see. I think breast cancer patients are some of the most informed because there is a lot out there. There are a lot of resources, and it's delightful to be able to back and forth with patients. But I think we need to do more to give them data to process and fill these gaps that we have when it comes to lobular in particular.
So, is there anything new on the horizon that you're excited about that you and the new breast cancer program, lobular breast cancer program at Memorial Sloan Kettering is working on in terms of research or treatment?
Yep. So my co-directors of the program are Dr. Sherry Shen in medical oncology, Dr. Frisia Pareja in pathology, and then myself. And we are, I think, very blessed to have this three-pronged team where we've got our expert in medicine, our expert in pathology, and then there's myself in surgery. So in each of our realms, but together as a team, we are looking at various initiatives of research for lobular. Dr. Pareja in the pathologic realm is doing a whole host of translational research, looking at the biology, the genomics, the actual pathophysiology of lobular disease. So in a very kind of biological sense, she's getting to the root of the nature of lobular disease. Dr. Shen is getting very involved in some research studies, both looking at management and understanding of metastatic lobular patients, but also investigating the use of things like circulating tumor assays, the use of certain new novel agents, and how we can pull those and apply those to lobular patients. And then for myself, I can talk in more detail about our own initiatives. We are looking to improve surgical outcomes for lobular patients. And I've alluded to a couple of times in this conversation already, but the rate of margin positivity from lumpectomy is problematic for lobular patients. And we are on the verge of hopefully opening a new trial, which will look at a novel approach for patients with lobular disease who desire a lumpectomy. And we hope to give them some preoperative treatment to try to treat their most likely hormone receptor positive disease in hopes of achieving a lower rate of margin positivity. So we are exploring this new pathway, which we're very excited about. And the group is hoping to accrue patients to the study, report outcomes in a couple of years. So that I think would be my biggest point of excitement at this moment. But a number of ideas are out there, and we are excited to explore all of them.
Oh, that sounds great. Um, so can you also share your thoughts about the importance of working with lobular breast cancer patients in developing and implementing your research projects?
Absolutely. I mean, patients and patient advocates are the key. I mean, we rely on those individuals to be our partners in designing research and disseminating research because you can do all the work you want, but until these results are known to the larger community and the word has been spread and these new ideas are applied by physicians everywhere, it's meaningless, right? So this is where I think, of course, our patients and the advocates in the community are very essential. I would argue that every practice changing thing that has happened in breast cancer in general, when you look back over the last 30 years, change never happened when the study was published. Change happened years later once people came to be aware of it and once advocates and patients themselves acquired that information and said, hey, why can we not apply this to my case? So I think it's a big team. It's a very much a collaborative effort, and we lean on our patients and our patient advocates to help us.
Great. Well, do you have any message for the lobular breast cancer patient community about your hopes for your work with LBCA and with the LBCA Scientific Advisory Board?
Absolutely. I have had the joy of a long relationship at this point with LBCA and yourself, Laurie, and some of the other members who have contributed. And it is such a delightful group. I mean, you are filling a void that was very obvious. And I think that patients out there who are seeing this or engaging with LBCA ought to take advantage of that community, of the resources. We hope to partner with you. We look forward to doing this work and disseminating it to you. So I think keep an eye out and certainly engage with the organization so that we can move this all forward.
And we have now with you 19 scientists on our scientific advisory board. I know that you have a relationship at least with one of them, I think, oh, well, two of them, Dr. Perea and Dr. Rita Mukhtar, who is the other surgeon on our breast surgeon on our scientific advisory board. But can you talk about the importance of bringing the scientists together into our Lobular Breast Cancer Alliance community?
Certainly. You know, a lot of the people on the board are people I have interacted with and, you know, encountered or engaged with along the years. These are incredibly accomplished individuals in their own fields who are working towards the same mission. So it's nice to see the whole group coalesce like this. I think that collaboration and particularly engaging scientists in this is essential because getting to the heart of lobular disease will involve understanding the science of lobular disease, of understanding it on a biological level. So yes, certainly surgeons can do their research and oncologists can do their medicine research, and we all have aspects in which we are investigating, but it all comes back to the biology of the disease. And that's where I think having scientists, having people who are looking at the heart of the matter in that fashion is crucial, certainly.
And do you see any opportunities for cross-institutional collaboration with your other colleagues?
I hope so. I would love that. You know, there are, as you likely know, a number of institutions now who had lobular cancer programs similar to ours, and many others that are expressing interest in doing this. So I think it's a rising
Yay.
tide. There's a lot happening now, which is so exciting. And I think the more people that we have who are interested, the more scope there will be for cross-institutional work. And that is the best you could possibly do. We ought to pull data together from different institutions. We should not be working in silos. There's power in numbers. So I think
Yeah.
if we all collaborate, that is going to be the best case scenario. And I would hope to do my part in helping with that for sure.
Well, thank you. Is there anything else we should know about you or your thoughts?
Thank you. No, I think you covered it. That was
Okay.
lovely. It's always delightful to speak with you. But I'm very excited to be joining this group in this capacity, and I look forward and I'm hopeful to continue to update you with the progress that we're making.
Well, thank you so much for a very interesting conversation and welcome again to our Scientific Advisory Board. I should note that Dr. Mamtani is helping us develop an online training series for interested patient advocates about lobular breast cancer and research advocacy, so stay tuned for that. Also, if you'd like to watch two other educational videos, about lobular breast cancer that Dr. Mamtani has participated on in the past, you can go to the educational video section of the LBCA website, where you can watch a webinar from last fall in which she and her co-leads at MSKCC presented a great overview of lobular breast cancer. And a webinar in 2023 was also created and included Dr. Mamtani on the latest in screening and treatment for lobular breast cancer. And thankfully, I think that's already a little out of date. So we look forward to all that you're doing. Thanks for
Thank
being
you.
with us today.
Thank you so much.